The focus of my presentation today is prevention, and in fact my presentation is entitled An Ounce of Prevention, because a big focus of what I will be talking about is that when it comes to value in healthcare, the old adage that an ounce of prevention is worth more than a pound of cure is extremely applicable. So I'll focus on prevention with a big emphasis on the importance of lifestyle management. It's extremely important for people to realize that they do have to assume personal responsibility when it comes to their health. If you ask most people what they value, they will say that they value their health, they value wellness, they value their quality of life. But yet, when we take a look at what people actually do in their daily lives, it doesn't appear that that is actually the case. There was a study published just this month in Statistics Canada in which they looked at a group of Canadians over the age of 50 who were followed longitudinally. They asked them about their lifestyle and health behavior practices before they had developed a chronic illness and then after they developed the chronic illness. And even after developing a severe chronic illness, most of them didn't change their lifestyles. So people realize the importance, but they don't accept the responsibility. What we have to do is engage each individual in the management of their own care, emphasize to them the fact that they have to assume personal responsibility, and then, very importantly, make available to them the tools that can help them to lead a healthy lifestyle and take better care of themselves. I think Canadians can learn a lot from other countries, some good, some bad. In many respects, for example, Canada is way ahead of the United States when it comes to healthcare. In most of the surveys that rate cost versus value and quality of care, the United States ends up near the bottom of the list. But unfortunately, Canada is not all that far behind. From a lifestyle management standpoint, though, there are some major developments that are occurring in other countries that I believe Canada can learn from. For example, in the United States, employers have now come to realize that most individuals spend the majority of their time at work. So if you can make changes to the work environment and get the employer to emphasize the importance of prevention, you can help people lead healthier lifestyles and also better manage their care. The system in the United States is obviously very different from a payment perspective, but what is happening now in the United States is that most large employers are actually paying for their employees to participate in health promotion and wellness programs, and also disease management and condition management programs. And not only are they paying for them to participate in those programs, but they're also providing financial incentives for individuals to be engaged in the program and comply with the program. I believe, based on what I've seen, that Canada is a little bit behind in that area. Part of it may be that the employers aren't as responsible for the healthcare costs of their employees. However, research has shown that when people lead healthy lifestyles, they also become more productive, and that can have major benefits for employers. So that's one area I think employers in Canada can learn from the United States and certain other countries and attempt to embrace a culture of health at the workplace. When it comes to health innovation and adoption of health innovation, unfortunately, history tells us that you really need small groups of individuals to lead the charge. You can't go directly to the masses and expect everybody to change. So you need relatively small groups of very well educated and passionate individuals to set the example and then help convince the masses as to what can be done. And I believe that this conference on global health is one of the many ways in which the Ivey School of Business can help us in the fight against chronic diseases and in our quest for value in healthcare by bringing together experts in the field, publishing white papers and setting the agenda for the Canadian public for the future.